If you've been wondering how to get the best results from your Botox, then this is absolutely for you today. We're going to talk about 4 things that are going to help you get amazing results. Those 4 things are being open to listening to your provider, also not getting hung up on the number of units that you are needing in order for your treatment, having realistic expectations and making sure you have a conversation about those realistic expectations, and lastly, how to communicate with your provider. So please listen to the rest of this video. We can talk through all of those things and help you get the best results for your investment that you've made in your Botox. My name is Dr. Lynn Neiman. I'm a board-certified anesthesiologist and aesthetic medicine provider at Blossom Medical in Northern Virginia. I'm so happy that you tuned in today to listen to this video. And if this is content that's helpful for you, please give me a little like and subscribe below. So let's get into this topic. So the first thing is you show up for your appointment with your provider and you have certain expectations and you really want a beautiful result. And let's face it, Botox is expensive. And when you go in and you spend your hard-earned money, you want the most amazing result possible. So let's talk about getting you that best result. The number one thing that I can say is be open. Be open with your provider about the outcome that you're expecting from your procedure, and also be open to listen to what your provider is telling you about the overall treatment. Sometimes you may have an idea in your head of an area or a result that you think Botox can give you, and maybe that result isn't actually possible. Or maybe the area that you thought that you need to have treated needs to be done in concert with the other areas around it so that it actually looks natural. Find a provider that you really trust. Find a provider who's got years of experience. Maybe it's through a friend who has had a Botox treatment before, or when you go in and you meet someone in consultation, sometimes you just have that gut feeling that this is someone who's listening to me, someone that I like the way that their, face looks, the results that they get, and they really have so their overall aesthetic is aligned with mine, and trust the recommendations that they're making to you. Most providers out there, I find, really want you to have beautiful results that you like, and they're going to give you recommendations as such. So listen to those recommendations and also trust your gut. If you feel like you're in a situation that's just not for you, it's okay to say thank you for the consultation and go on your way. But that way, you can remain open to hearing what your provider is saying to you and just always making sure that that treatment is aligned with your goals in the future as well. So stay open. Be open with your provider about your expectations and also listen to what they have to say in terms of treating you. Number 2, don't get hung up on the number of units. I talk to my patients, and when we get ready and prepare for a treatment, we do what's called facial mapping. I will go through the different areas of the face where I think they might benefit from a Botox treatment, and we talk about those areas, which areas kind of go together, like maybe the upper face, like the crow's feet, forehead, those 11 lines in the middle of the forehead, maybe things happening down on the lower face, but certain things just go together. And we talk about how when we treat areas together, we get a more natural result. And we also talk through how many units would I recommend. There are FDA recommended on-label dosing for areas that companies will go through the FDA approval process, but then publish and train their providers. And just with years of experience and the tens of thousands of Botox treatments that I've done, I've seen, and in my hands, I know the results that are going to help patients get the results that they need. And sometimes that number might be one thing for your friend, but it might be a little bit something different for you. All of these treatments really need to be based on guidelines and the studies that our drug companies have done for us, but then also the expertise of the person holding the syringe and delivering that treatment to you, and your own facial anatomy, which can be unique from the person who's next for their treatment. So think about it this way. We'll think about it with ibuprofen. So if you had a really, really bad headache, you might take you 600 or 800 milligrams of ibuprofen to treat that headache. If you use 50 milligrams of ibuprofen, are you still taking ibuprofen? Yes. But is it going to give you enough medicine to actually treat that headache? The answer is probably not. There's just a certain number of units that it absolutely takes in order to get you a treatment. And so your provider is going to give you that number And they're also going to want your treatment to last as long as possible. So treating a muscle and having duration are going to dictate the number of units that we're going to use. Your job is to not get hung up on the units. One other thing is that sometimes when patients get really nervous about the number of units, they try to talk to me about ways to use less units. Sometimes less is not more. This doesn't happen always in life, but in Botox, sometimes less is not more because it can actually lead to, first of all, your treatment not lasting as long as we want it to last. Dose equals duration. If we underdose you, you're not going to get the duration from your Botox treatment. And then in your eyes, when that's wearing off at 6 weeks or maybe 8 weeks, then it's not worth the investment to you. You still invested your hard-earned money and you're expecting a treatment that's going to last for 3 to 4 months. We definitely want to get you there. And so there's just a number of units that's going to take to get you there. And then also, if we only treat one area or one area in isolation, sometimes that can lead to results that are maybe a little bit off. And the example that I have for you is the muscle that lifts the forehead. Some people will come in with lines across their forehead and they really only want to treat that area. That muscle is the one that lifts the brows. We have two areas that pull the brows down, in the middle of the forehead and our crow's feet. And if we leave those unopposed, in my head, I think about kids on a seesaw, if you remember what that was like on the playground. But if we take away what's lifting, then all we're left with is the fully active muscles that are pulling the brow down, leading to a kind of concentrating or maybe kind of an angry expression. And so even though that may be the only thing that you're concerned about, if we don't balance those muscles out, it can lead to a result that you're not happy with because overall it's an expression that's not balanced and pleasant and what you're expecting. So don't get hung up on the number of units. The number of units are just what it's going to take to give you the result that you want. Have that full discussion with your provider. And don't worry, there are guidelines that we are using. We're not going to overdose anything with a Botox treatment for your face, but we do want you to have an outcome that you love, that gives you a pleasant expression, and also that's going to give you some duration so that it is worth your investment in the long term. And then another thing that I want you to have is realistic expectations. Botox is a muscle relaxer. So we all think about it like it's going to treat the lines on our face, which it does, but it's kind of a secondary side effect. The way that Botox works, it actually works the place where a muscle or a nerve cell gives a muscle cell a signal to contract. And what Botox does is it actually just reduces that signal from the nerve to the muscle to contract. So our muscles just kind of, we politely ask them to not pull so hard. And that action decreases the pull of the muscle on the skin and it relaxes the lines that we see on the surface of the skin. So our treatment is actually relaxation of the muscle, and that leads to a side effect, if you will, of reducing the line that we see on the surface of the skin. Because that's the case, we can treat lines that form with muscle pull really, really well with Botox. But there are other reasons for lines on the face. Some of them have to do with volume loss, whether it's volume loss in the fat pads or bony volume loss underneath the skin. Some of the lines that we see on the face have to do with a state of collagen or skin health and hydration. And so we can't expect that Botox will take away or is able to resolve every single line on the face. So we have to have realistic expectations about what our Botox can do. This is a great piece of information for you to have a discussion with your provider so that you are sure when you leave, you know exactly which areas are going to be treated by the Botox and which areas may not have a full resolution after your treatment with Botox, because there's nothing more disappointing than you thinking certain lines are going to be able to be completely treated, and 2 weeks into your treatment, you're finding out that those lines are still fully present. That's a discussion that you should have with your provider. All of your providers worth their time and worth your investment are going to talk with you about what kind of results you should expect from your treatment and where you might not see a result from your treatment. Also, remember this, and it's really important, especially if you're having your very first Botox treatment and you're in maybe your later 50s or your early 60s, you have had a number of years where those lines, maybe something that you're concerned about, has been present. So one single treatment with Botox may not make that line go completely away. It should always soften it, but it may not make it go completely away. Typically, in somebody who's had more static or etched in lines, maybe those 11 lines are kind of deep, it's going to take a little bit of time for those lines to soften, and they may never fully go away. But as long as you are okay with the thought that I would be happy if those lines softened, then you're going to be satisfied with your Botox treatment. But if you want those lines to completely go away with one Botox treatment, you might be disappointed. So it's just really important to have realistic expectations about what your Botox treatment can actually do for you. And lastly, I think this is really critically important. It's to communicate with your provider. It's important to communicate what you are expecting from your Botox treatment so that you can have a frank conversation with your provider about what's possible and what might not actually be possible from your results from your treatment. And then also, you definitely want to just go back for a 2-week follow-up if your provider offers that to you. Every single new patient who comes to me is offered a 2-week follow-up visit. And that's so I can see the results that they have had. We can communicate about their experience with Botox, and then also I can make any adjustments or tweaks at that 2-week visit in order to give them the best possible treatment for their Botox treatment that is possible. And then also I can keep a record of it in my medical notes so that the next time that patient comes in for a treatment, we can refer back to that and hopefully give them just as perfect of a treatment the second go around. That's so critically important. Sometimes I have patients who tell me, oh, something just, I really liked the way that my eyebrows looked with this treatment, or I didn't get the same lift that I got the last treatment. The best way to show me what you mean exactly is to take a selfie, take a picture. So for your providers, take a selfie, take a picture so that you can bring it to them at the next treatment and you can let them know, this is what I saw, this is what I experienced. Maybe I liked this, maybe this what bothered me just a little bit, and you can talk about how to optimize your treatment. So communicating with your provider is critical. Your providers, especially the ones who are really good, and especially if you're a patient in my chair, I want you to be thrilled with your results that you have. And so if there's something that I can do to adjust your treatment to give you the results, I want to know about that. So if there's anything at all in your eyes that you're experiencing in your treatment, definitely let your provider know. So again, let's just recap. Be open to your conversation about your provider. That's tip number 1. Don't get hung up on the number of units. That's tip number 2. Number 3 is really have realistic expectations about what we can treat with the Botox treatment so that you're happy and thrilled with your results and not disappointed when there was an area you had an expectation we could treat, but we actually couldn't treat. And also, and lastly, is just communicate with your provider so that the two of you can be on the same page and really working to optimize your results and give you results that help you feel confident and glowing and amazing about yourself and feeling like that inside is matching what you see on the outside. That's so critically important, but your communication is definitely a piece in that puzzle of getting you the ultimate best results you can possibly get. I'm so happy you tuned in with me today, and I hope that these tips really give you some just tools in your tool belt so that you can take those with you to your next appointment and get the results that you're after. Because after all, you are investing a lot in just a lot of cash and your time and your hope in a treatment, and I want you to definitely have the best results. Definitely, if you feel that this kind of content is helpful for you or might be helpful for a friend, I would love it if you would share it with them, like and follow. And if you are in the Northern Virginia area, I would love to see you as a patient in my own clinic at Blossom Medical. If you are not in the Northern Virginia area but are interested in doing an online skincare consultation, we can absolutely offer that to you no matter where in the States you are. Absolutely have a beautiful day. Take this information with you to your next visit, and I'll look forward to having you tune back in for more information on everything aesthetics in the future. Thanks a lot for tuning in.